Good afternoon again. I'm Julie Cornell. We're going to go to the Douglas County Health Department where they're giving us an update on COVID-19 today. We understand that 2 long-term care residents of the Douglas County Health Center have tested positive. Let's listen in.
I have our chairman, Commissioner Claire Duda, and he is also the vice chair of our health center. And then I have Commissioner Chris Rogers, who is the chair of our Board of Health. We have our Chief Administrative Officer, Patrick Bloomingdale, Dr. Adi Poor, Aaron Nelson, who is our Douglas County Health Center Long-Term Care Administrator, and Mayor Stothert. I am Douglas County Commissioner Marianne Borgeson, and I chair the Board of Trustees that oversees the Douglas County Health Center. For those of you who do not know, our Douglas County Health Center is located on the corner of 42nd and Woolworth. Our facility houses 3 very distinct services: our Community Mental Health Center, our General Assistance Primary Health Care Clinic, and our long-term care services. The majority of the beds in that facility are our long-term care beds. Today we're here to let everyone know that on March 28th, 2020, we received confirmation that 2 long-term care residents of the Douglas County Health Center tested positive for COVID-19. The long-term care residents who tested positive are in isolation in their own private rooms, and they're being monitored by staff. The families of the residents were immediately notified after confirmation of the positive COVID-19 test. Douglas County has been utilizing and adhering to the CDC recommendations for the past 30 days. On March 10th, 2020, all visitors, volunteers, and vendors were restricted from entering our facility. All approved staff are screened upon entry, and the staff members have been wearing face masks through the building since March 20th. We want the public, the families, and the friends of the loved ones of our residents to know that we are taking care of them and they are our top priority. We are doing whatever it takes to make sure that they are taken care of. I also want to emphasize the importance for everyone that you need to take this seriously. We need everyone's help in this. We need you to stay home. We need you to practice that social distancing. These measures do not only protect yourselves, but they protect each other, and especially our vulnerable populations. I'll ask Aaron Nelson to come to the podium now, and she can add some further comments and answer any of the questions that you may have. Aaron?
Okay. Hi. We do have the 2 confirmed cases. They are contained on one area of the hospital right now. I toured the hospital just now, the health center, and we have no other cases. All the residents are doing really well. Even the 2 positive COVID cases, very stable, having no issues. We continue to consult with Nebraska Medicine. We have an infectious control preventionist that we've been using for several years. So he's helping to guide what we're doing in the system right now. We have plenty of PPEs for the staff, so that is not a concern for us. Our residents all seem to be doing incredibly well.
Are there questions for
How many
Aaron?
residents are there
We have 237 residents
in the long term?
in the long-term care.
And do you know the age and sex of the people who have?
They were both females in their 70s and 80s.
You said we're 247 or the number of people, but what's the facility built for? I look at all the prisons are overcrowded.
Yeah.
Is this also a problem with the Douglas County
No,
Health?
we have 237 residents right now. We have capacity for 254.
Given all the precautions that you mentioned that were taken, why do you think this happened?
Well, I think once it became available in the community, it was a community spread. We believe it was a staff member that brought it into the facility. But we have taken strict precautions. We immediately went to face masks as soon as the CDC guided us there on the 20th of March. And so right now everyone is using face masks and appropriate PPE throughout the building.
Has that staff member been tested?
Yes, it is a pending test at this point.
Pending test.
And just the one staff member, or?
Just the one that we're aware of, yes.
In regard to the two residents, have they always been in private rooms or have they shared rooms with
No, those were all in private rooms. Yeah.
Were they active in the community, or were they basically staying in the room the whole time?
They are in their rooms the whole time.
Well, I mean,
You mean before that?
Yeah.
In general, no, they did not. They weren't extremely active. They stayed mainly on their neighborhood, their unit.
Okay.
When you say stable, what symptoms are they exhibiting, if any?
I think just the normal symptoms that have been broadcast, the fever. A few of them have been put on oxygen, so respiratory issues. So, but are very stable and being monitored.
They're both on oxygen?
Yes.
And are the other residents checking for their own symptoms and temperature?
Yes, they're all have been. They're all staying in their rooms at this point. We're taking temperatures every shift, so being very closely monitored by the staff.
At this point, I would ask and invite Dr. Adi Poor to come forward to give us a little broader view of Douglas County and where we stand with cases and the testing.
Good morning, everyone. I want to start with actually my heartfelt condolence to the first case that related to a death in our community. You have heard about the individual in the paper. I think it was a very special individual. So my condolences to the family of that individual. What I want to share with you today is I shared with the media yesterday. We had 10 new cases yesterday. We have 9 new cases today. You may say, why so many? I want to make sure that you understand that, as we have said a long time, more testing, more identification of cases. Yesterday, I can tell you that one of the laboratory had done more than 100 tests that have never been done before. So we are really lucky in this community that we are seeing testing increasing significantly. But as can be expected, we also see more cases. From the 9 cases that were reported to us today, there is one that is hospitalized. It's a woman in her 70s with several comorbidities. That's always the people that we are most worried about because they are at high risk. 4 of the individuals had direct contact with an individual positive for COVID-19. 2 were travel-related, and 1 was a community spread. The other 3 are being investigated as we are talking now. Just to follow up what Commissioner Borgeson and Aaron Nelson told you, I had a long conversation this afternoon with Dr. Ashraf. He is the infectious disease consultant for the Douglas County Health Center, and it was probably the best conversation I have had today. Can tell I had many of them today. He is an infectious disease doc at University of Nebraska Medical Center, specialized in geriatrics. He also is the director of Nebraska Infectious Disease Center here, and he's telling me, a national expert. He actually helps write guidance and recommendations for long-term care facilities. So having known that, and as he went through it with me, what his experience is, what he has heard, what is happening at the health center, I feel very comfortable that the decision and the recommendation he made are the best of it. And I want the community to know that too. What I would like also to share with you is, and I think it has been beneficial for all of us to know, what is really the capacity in our community in regards to hospital beds and ventilators. So as the newest data I just received was we had 620 beds, that's med and surg beds available, a 43% occupancy. So that means 57% of our beds are open. In this community, we have 264 ventilators, and 57 of them were in use. So again, this is encouraging. We do have a capacity for more individuals. So that's kind of what I want to share with you, and I want to close with all of you how important social distancing is. Coming here, driving here, I had to say to myself, how many people are taking this serious? The streets are crowded. Traffic is still ongoing. I should only see people being out there on their trails, one person or two person at the most. We shouldn't see all this traffic that we are still seeing. There's an interesting study that I may just share with you that comes out of Google, where they are looking at the traffic pattern that the community has. And what they see is if they see less miles being traveled since these direct health measures went in place, that actually tells them what is the compliance of a community with the direct health measures. I'm happy to tell you the state of Nebraska gets an F. That is not good. But the county of Douglas County gets a B, meaning they have seen a 33% decrease in travel distance the moment the direct health measures went into place. But 33% is not good enough. To actually have an effect on this virus, it should be around 75%. So I really want to encourage this community. Take the social distancing serious. I hear a lot of complaints about these big Menards, box stores, so to say, that they are just busy as ever before. That shouldn't happen at this time. So all of you, please take this to heart and let's practice this because it works. It works. I'm open to a few questions that you may have.
Doctor, how concerning is it when there's multiple cases in a long-term care facility?
You know, this is not different than what we see nationwide. It's a huge concern. There is no question about it, because in long-term care facilities, you have high-risk individuals. Most of them already have some underlying illnesses. And what you really want to prevent is you want to prevent hospitalization and death. And so therefore, long-term care facilities and individuals who have worked in long-term care facilities, honestly, I hope I do not see one single one of them in the community going to a grocery store or going to a Menards or another box store. That's my message today. That staff, because those long-term care facilities, as you have heard from the administrator, usually the residents, they don't go out, they don't go around. So how are they going to be infected? By a staff member bringing it in the facility. And so if anybody wants to be serious about this and not put those high-risk individuals in jeopardy, that's what needs to be followed at this time.
Joshua, when you see people not practicing social distancing enough in Douglas County, what would you tell them the consequences? What's your worst fear?
Well, the consequences is that we potentially come to a lockdown. That's what many states are doing. More than 24 states have lockdowns. We have always felt very strongly that we did not want to go there if it wasn't necessary, and our infectious disease experts tell us it's potentially not needed to go there. But if we have no other choice, then we need to go there. I have to tell you, when you talk about bars and restaurants, we have seen great compliance from those businesses. We have heard from Nebraska Furniture Mart. You heard about them Friday. I expect that all the other businesses are also helping this community to really work through this.
When would a lockdown be necessary? What would that line be?
You know, we always ask that question, and I think I would defer to the infectious disease experts. Probably an increased number of cases, more widespread, but hopefully we'll never have to get there.
Would you suggest that Governor Ricketts close down these big box stores?
You know, I get a lot of questions who say, why am I not closing them down? I don't want to close them down. I would like to have compliance. I would like to see that if somebody needs to go and get something, that they have that avenue still open. Because I don't want to put a hardship on everyone just because most of the people think they now have to do their home decor projects at home. That's not what it's about. It's about those who need to go to those stores should be able to go to those stores.
The two women diagnosed here, they clearly have some sort of chronic condition. Is that
At the health center, you mean? Yes, they do, according what Aaron just shared with you. Thank you.
Few words from Chair Duda.
Thank you. Well, I just wanted to make one additional point relative to the situation at the health center and the precautions that have already been put in place by our staff. The staff member that was infected, this was in fact picked up on a routine temperature screening as he was coming in. He had no idea that he was carrying the COVID, but our routine temperature reading showed that he had a slightly elevated temperature. He did not come into work that day, went into isolation, and later we found out that indeed he had been exposed. So we do have precautions in place. I'm sorry they didn't catch him quite in time, but they did help this from becoming much worse than it could have been otherwise.
I'd like to now invite Mayor Stothert to say a few words. Oh, come in the corner.
Thank you, Commissioner. I'm here to really support and emphasize what you just heard from Dr. Poore. As we continue to learn more about this disease, the transmission, how people are inoculated with the disease, we are finding that the social distancing, the hand washing, the not touching your face if you've been out in public is more important than anything. The Omaha Police Department for weeks now has been going out all over the city 24/7 checking compliance of businesses, of restaurants, of bars. And they have found, and I have said this many times before, that people are largely compliant in Omaha, but not all are. And what we have seen, Dr. Poore mentioned the big box stores, and I want to mention their names, the Menards, the Home Depots, the Walmarts, the Costco's, the Sam's. I drove around yesterday myself just to check. The parking lots are full. And you know, a lot of people are saying the doctors and the nurses are the lifesavers. You all are the lifesavers. The people in the cities are the lifesavers. You know, stay home means lives saved. We know that now. And I am pleading with people that are visiting and shopping in these crowded stores to not do it. I'm pleading with the managers of these stores to please keep the crowds thinned out. We don't want to have to take that next step and close these stores down because people are buying their food there. People are buying the things that they need, but they are not being compliant. We are seeing it. And we cannot expect the Omaha Police Department to be in all of these stores 24/7 trying to regulate the crowds. You are the lifesavers in this. And that's what's important. You know, think about it this way. The greatest generation that we call it was called the war. We are asking you to stay home. And if you stay home, you can be a lifesaver. And so that is what I'm asking you today. There's nothing more important right now than the social distancing. If we all do it, we can stay at home for a while, but if we all do it, we definitely will be saving lives. Thanks.
Thank you. And again, I can't express our gratitude enough to the media to be here every time we put out something about having a press conference because it is your help and cooperation in getting the word out to our public. But again, if you can emphasize the messages that have been sent today about being compliant with those recommendations, it would be very helpful. So again, thank you, and any further updates, we'll be sure to let you know. Thanks you for being here today.